Dr. James Justice or Natural Link UK. Or yeah, certified natural medical practitioner or yeah, nutritionist, gerontologist and a health educator. Wabeka yensa yebebo nkomo ewo the natural health segment. Just 30 minutes pe. Nti yenche ho kra no yema Dr. James Akwaba na ene de wahyehyɛ ewo ho so one yebetwe ho nkomo no yema Dr. Kwan no ne yema nkomo doc Akwabo.
Yeah, nua. I hope they say my pass it.
What pass it no dia ne assalamu alaikum.
Yo,
and doc unim nyeswana na.
Oh yeah. Me okay with that.
Unim nyeswana.
Yeah, I'm saying the other terminal. We were talking about it. I think just shortly about the response. Just because when you don't concentrate, you be thinking about something else. Now you may just respond differently. Yo, and yeah, Abafumo, Mobia, good afternoon. Nyamiasi say, another opportunity after 2 weeks. You know, say, Yensu Ade Kakra about Yapomidia. So be out for the first time. I'm doing Dr. James now. Me a certified natural medical practitioner, nutritionist, and health educator, and also a gerontologist. It means a doctor specialist for the aging. So that is in Yarawa, affect your maintenance. And yeah, topic enlarged right heart, enlarged right heart. Papa, met me akoso.
Yanko straight away. Why?
Yo, enlarged right heart. Now, firstly, a little bit of the to describe a simple way the anatomy of the heart, because one anatomy nasi kakra nasi sene akumanan kasatia is difficult to understand this disease and this condition. Nti mecheche mukakra na fin so ya share the symptoms ben na obehu say or enlarged right heart nothing so no the ede eba na at the tail end and so near me betimi aya betimi prevent right heart enlargement and now say to take care of our heart na bia questions bi o honoma na fi ye dia tujan so na yetimi as asuade further. And you share akomano, you say akomano the engine of the body, just like the car. The engine is quite, relatively small. The same thing with the heart. The heart, a very small pump. In fact, when you fist up, it's just about the size of your fist. And the heart, sometimes you describe on say right heart and then the left heart. 4 chambers nti ebia ye Ghanaian language because chamber and hall nti eban say chamber and hall double into the top chambers and a receive blood and then the down chambers and a pumping chambers now you share the left pump and the left ventricle, actually medically that's the left ventricle nti eban say the left pump and the main pumper a pumpy moja ekonipeduanim nyinara na the right pump and a pumpy moja echo yahrawa anase the lungs normally a bit pumpy say brofum say oxygen that is the deoxygenated blood. It means blood oxygen in and a core yahrawa na ako receive the oxygen. Now, and also so now are passing on, of course, to the left side. Now, are pumping to the whole body. Until at least, we in 4 chambers, at this point, person will say this 4 chambers, and as the left heart and the right heart, there is a wall. There's a wall, a divide, until we should understand, say, if the wall is affected, it's affect the health of the heart. And a command so no inside you be valves a year medical valves, but literally no you bet me doors. The doors are a direct moja in one way direction. Send a moja and sign the chi. Indeed, that is the function of those valves and also. Indeed, it gives the actually direction for our blood to flow smoothly in one way direction. Akoma no so no electrical pattern so and then it control the rhythm of the heart and also the pace how akoma no ebeye betimi abo. Nti say tiwe ase dia, then of course we are going to understand this topic, enlarged right heart. Na yesha makuma, that's very interesting. A bit smaller and a bit faster than men's heart. That is the point of interest. I think so no. Important also to note, say that could be one of the reasons a man are more emotional. They are a bit different from men, and the men are, of course, less emotional. This is also a point of interest. Akumani eye juma eye pa a pompi moja 2,000 gallons a day. It doesn't, of course, stop. It stop what nipano. There's a onwano onihobio. But of course, anajua dano from 10 p.m. air kono. Normally, no, akomano is supposed to change the mode. So that is the resting time. And as a timer, akomana kasa yeden, it mean a recharge no ho. And intina ana anajunda is very, very important for us. But ana nipa bibrana yentia se anajunda no important. But day sleep no unya sabi health benefit be especially for the heart. Now yɛhwɛ right heart symptoms no sɛ bia ɛkwan bɛn so ɛna wobɛhu sɛ akoma no right heart no ayɛ dɛn ɛtɔ kyima yɛntie ne yie paa saa symptoms yi nso no ɛyɛ symptoms a sɛ if anything happens to the heart and as akoma no nkasa ɛnyɛ dwuma yi a yɛbɛtumi ɛhu the same symptoms. It's not just necessary for only the right heart say ayekasiye a intimi enye den enye najuma eyi yehwe mapa ade a etimi ede ba pa no eye say yahrawa no say yare bi bona ena otumu say sa problem etimi eba pa ba yebekọ sa course so no so very very soon, but for now no a day symptoms and signals and you bit me say ebia onipa ewo right heart problem. Normally no enipa no first point no chest pain, but enya apart from say benya chest pain also no say enipa no bones and the chest ankasa no there's a pressure build up ewo the chest no, but yemfa symptoms at least 4 or 5 symptoms embom near who say this is what is happening to you, this is about the heart. Apart from that, nipa no bones and nisu ebichin kakra na ayese ofenti bi nso sisa if any syncope medically no syncope no na se kyerɛ sɛ mogya no enko nipa no na adwene mu eye nipa sɛ mogya anko wadwene mu eye pa obon sɛ obetimi ayɛ den ate ahwe na kyerɛ sɛ there's a fall nti wohwɛ a the elderly after 60 years of age no sɛ nipa no moja amfa ne nipadua no mu ya mostly no omo wo ntima emu ACC most people from 60 no, but even these days no it doesn't even start in the past in the 60s, but now no it is like from 40s air now no now there is a condition called atherosclerosis that is ntima emu ACC inti ebasa na se moja anko utim kakra bi pa bonso wani su chiu anase utimi etihwe suddenly inti sudden fall no because of that lack of anase reduced blood flow to the brain. Indeed, that is also there. Another symptom, so say, any panels of footsteps, and also or go uphill. Now, or yes, short of breath. Indeed, so feel say you are short of breath. And if first, ultimately, it to me can find it to me your bus, and I say to me, cobe beer, a year near my head, but ombre, but say no, as when you see chin, fenti, cacrebia no breath. Who say, feel this symptom. Yeah, that definitely no unse akomano enye ejuma eyi na afise tembia na nipa no na say wa bread, that's a general fatigue. Apart from that no so no bonso nipa no so lose appetite, uni appetite the emphasis symptoms enka ho yare ne konanima say wakoma mremo a before ubobohu no na onase nso den na tatai unasi tata bit me eba say a few kidneys and now say bit me fi to extreme cases, about the liver. But these are rare cases about the liver. But common case in a heart. Apart from that, is the kidney. But say a heart there, not other symptoms here, making fainting, shortness of breath, dizziness, and then feeling full on the chest or experiencing angina. That's the pain in your heart, and I say in the chest, and also so betimi affelesa. So these are common symptoms of any heart disorder, not only about enlargement of the right heart, inti yentimi enhye so, but a day right heart enlargement, a day eba. Yehwa say na mekan, most common cause no pa no say yare bi a epie ana aba ewo yahrawa mu, that is the lungs. To say eno epa na etimi e cause that problem, but there are other causes as well. Yehwa when there is what they call the pulmonary hypertension, that is the blood pressure build up in the artery, and I say from the heart to the lungs, and no say pressure woman no ekosruka krapa ubon say betimi affected the whole arteries and I say vascular system no by a basana pressure no build up our arteries na a supply blood to the lungs in the pair. Ubon say wakuma no the right heart no a try say a bit compensated by overworking in so doing na den na and also so na kasiye. But kasiya, in fact, kra mostly symptoms makra because the left heart a bit try say a be to compensate the shortcomings of the right heart. Inti ebasa na sanipa no hwe je edu echiripa anase the nipa no ne na hrawa no ay affected then these symptoms na maka wasem na ayden na apie na apart from say ebia wahrawa ebe ubenya problem from there no, there is also heart failure. So akuma no failure, it means that generally the whole heart can be weakened. If the whole heart is also weakened now, definitely it can affect your right heart na and also na ayekese. So that is another cause. But Obibeka say when do people have that heart failure? In fact, akuma no organa say kofoma unhushio until say akonanim na fe won say ebia symptoms be ppt sesen bia say na maka say you feel general fatigue bia na wabre na ofo steps na eden na I say ohome na when you chin wo na unya pins and needles numbness ewo nsa and on also your feet. That is also another thing I say ubetimi ehun say ebia akoma na yeden ekofom. Apart from that, and there's a very common lung problem, your friend of COPD, that is chronic obstructive pulmonary disease. Now, COPD, the common problem part of the another, and I say, you can't say COPD now. Yeah, breaking it down. I see it's just a group of diseases and yeah, I affect yahrawano. Now, COPD, a common example of this disease, your friend of emphysema, no. Say ubon se ahrawa no ewo air sacs medical your friend alveoli that air sacs and a boy made me exchange oxygen, that is, and then carbon dioxide, but unya emphysema ya and no bone say x axis etimi den damage into basana onipa na intimi enya enough oxygen. That is very, very common power. But a day emphysema ediba. Normally, no smokers, primary smokers will be on cigarette, a common cause of power. But because Dr. Media may num cigarette, but ujna will be enchaya or cigarette. That is the secondary smoker. Even more serious, and as a restaurant now, be almost smoke now, you don't smoke, and no, more dangerous. Indeed, if you inhale, those are irritants, it may cause this emphysema. Apart from that, no buo has sebi now or the chemicals juma or the cleaning and I be or ye barber na say or your hairdresser chemicals are use no irritants a woman a core a in fact it may cause this lung problems and so yɛhwɛ nso a environment nso any clean no examples wɔ London ha na sɛ wɔ major city bi mu a the pollutants no mfa ani hu especially ɔmo so ɔmo kɔ jogging no very very unhealthy to go jogging in the city. In fact ɛno kora nhwima mmiɛhu sɛ ɛma ntumi kora sisi because cause inflammatory condition nti sɛ jog a you inhale a lot of irritants a ɛno nso so no betumi lead to this COPD. Nti we shouldn't jog in the city. It's not healthy. Ubetimi a jogo ewo maybe at the countryside. Baby, you have a feel say the air is very clean. Into me and cause lung problem or atherosclerosis. That is the plugging of the arteries. Another cause, pulmonary embolism. As you say, pulmonary embolism, PE. For short, no. So because when you say when you pulmonary embolism, as you say when you black clots are a lock up in the lungs. That is nahrawano. And also normally in a basana a restricted blood flow, not a decreased oxygen actually in the blood. And also basana akumano susu will be overworking, especially that's the right heart. Na amakumano na eden na yekese. The function of the heart. Akumana nkasa no sɛnea ne structure teɛ no sɛ bibi ɛka no pɛ a ɛno nso so ɛtumi ɛma right heart no ɛyɛ kɛseɛ yɛfrɛ bibi a yɛfrɛ no atrial septal defect aseɛ ne sɛ atrial septal defect no sɛ holes tokuro tumi ɛba walls no mu between the right heart and the left heart no aseɛ the upper chambers ne lower chambers ne nia sɛ holes kakra bi bɛ mu pɛ a ɛno nso so bɛtumi akɔ so this right enlargement no na amasa yadeɛ nso ɛde aba valves no ɛwɔ mu no that is the doors no ɛwɔ mu no nso a directed blood no nso no sɛ biribi ka no nso a na ɛnyɛ dwuma yie nso a ɛbɛti ɛno nso so bɛtumi akɔ so right side enlargement or the enlargement of the heart in general. And these are the key causes of the right heart. To say you share in your way I'm mentioning you try say if you're a smoker and you have to stop, and if you're not a smoker then you have to be careful about say you don't get near or stand near, this smoker, the common cause. Then you have to try to strengthen your heart. Is so important. Now, send your heart be balanced. And then, of course, in very, 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 very important. Or diabetes, then you have to also be careful because normally diabetes is in timo. If you treat it naturally, diabetes type 2, is 100% reversible. These are some of the key things you have to take note of. Well, since at this time, let's say questions maybe some casa further questions we can share that together. Now it me and answer that time edu.
You, Dr. James Justice. Once again, life is delivered through you to give us such a very wonderful education. Enlarged right heart. What can some radio out of where walk kasafidie no so say utie na obepe say obe type or question any whichever platform I will use to watch we will be able to monitor your questions, your contributions over there. With mature questions at the afar Facebook, YouTube, and also even Twitter. Na ya kenkan at the amount. Nti say adofo so no ebi question there uma ansaswa. I'll let you come in to ask your question. But doctor, I say Isaac Abadi and mama so. Dear Ben, Anna obey to me aye as a night worker to strengthen your heart. What can you do as a night worker to strengthen your heart?
Yeah, very good. So, Juma Nafia, night duty. Of course, it's not your fault. Juma, we into professional. But advice man says any panel say in future be on your option of doing day worker. Next or so try so you do it. But say only panel a year night duty ya cha. One of the ways natural ways in quite a bit more strengthening heart and be going to me for chemical and I say allopathic medicine and found strengthening heart. But through herbs, we are your herbs formation it is formulated just for the heart. It means strengthen akumana. That is one option. Other options, so what they call the high intensive interval training. It means oh yeah, exercise be just a benefit bit me build or heart. You can say high intensive interval training. For example, you bet me use a stationary bike. I high intensive interval training. Say ote bike and also obuaha ote bike and also bet me a bike continuously for about 10 minutes. Instead of you biking continuously for 10 minutes, you know, bet me a bike about 2 minutes, but vigorously. It means so bit my back in 10 for 2 minutes. Now while resting for a minute. Now if it was bike vigorously for 2 minutes if you was resting for a minute and that's a 2 minutes cry. Now I come and abba form into bit my yourself about 5 times and oh yeah, it's much better than say if you're bike continuously non-stop for about 10 minutes. Into high intensive interval training, it bet me use different form of exercise to actually work out the heart. This is one of the powerful kind of exercise to strengthen the heart. Now, and of course, you're doing the demon so very important. Say, undi mujanam eno wow ene niyama say nnuane yata echichi and all the dear intimate more, especially omomudi abonten no deep fried potatoes. So it's very damaging to the heart and the liver. Potatoes, you say, you know, are very healthy when you cook it. That is the only form are healthy cooking. But when you bake it now, it has a very high glycemic index. It means the sugar woman are very high. When you fry it in soy, it's deadly. It affects your heart. It brings down the health of your heart and also your liver, and it causes constant inflammation in the body. Unfortunately, in Kolaya, Woma, Brichana, in Penifono, this is what they like to eat. They buy it outside and then they add Coke to it or some soft drink. And this is very damaging to our health. Right.
Na doctor nti big companies now omo ton chips ne nase for no wo nim say damaging to the heart there.
Say papa the problem say you say has say no no crani hobio na afen so no omunim so omunim omunim kra ombeton because of the fact say sika a business mom she Coca-Cola company Diet Coke for example there's aspartame a carcinogen cancer causing agent as they say no announced officially by World Health Organization say a cancer causing agent to say it meet the cancer but unknown Diet Coke any other soft drinks be example chewing gum or betinium it contain aspartame. This is the cancer causing agent. Now companies they are aware of that, but say a business. In fact, it was known many years ago. But I know my baby sounds I didn't and a World Health Organization announced a long time ago because announced will be almost business. Indeed, business is kind of taking priority over the health of people and as a general public. Inti say when yanim dia untimi enya den embo ho ban very important. They know it very well. And it may be enya healthy. And so people are involved in selling them. They are doing business with them. Alcohol, cigarette, they are all examples. We know very well that they are not healthy, but still people are addicted to that and they are still smoking. Coke, people still continue to drink Coke and Diet Coke. That's why I said they have announced it. This is human behavior. It's very difficult to understand or even to actually check it.
Thank you very much, Doctor, for that boldness. We are cosmic carriage partner Kasano. Isaac, what's the
Yeah, I'm a
you any doctor?
It's a good question.
Mm-hmm.
It's a good question. Na kakana me de kan odi no na me de me question na ai sa question dey me sure say doctor be me man because say on you. Doctor, na adentina na just say World Health Organization omo ye wiki because omo nim say sa ai omo nim say sa nyema nyina no ewo aduane mu a etumi di e how ebe nipa adentina omo ma ai sa omo ye potato chips ni ade no entrengu omo label no ho te say cigarette for aye omo de no say wo koto cigarette onim say ya tro wo ho say which me how ebe how akuma which me how akuma na ebe how akuma nti no to ho physically to na mo ye mo so enye the same sign no engu o mo label no okay we dey me dey film na me question is say hey dog nyame show yeah
Amen.
because
Amen.
nchechemu a de break de bia no in fact boy pa
Amen.
me question is say hey na o jog ya wotumi sɛ wakoma ho hyehyew because woyɛ bi akyɛ na afi na wo start sɛ woyɛ wakoma ho hyehyew ɛdeɛ na ɛde saa problem no ɛba.
Well, so unim say nipadua no un say obi wɔ ha a ɔyɛ exercise akyɛ. One say imagine so exercise akyɛ na afei wo start sɛ o work out a bon sɛ muscles no koraa no na kyɛ sɛ ɛden nti adeɛ a na wotumi yɛ no na afei wontumi ɛnyɛ nti take a very 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 gradual. Normally bi a woyɛ exercise akyɛ anaa wo jog we koraa akyɛ anaasɛ wo njog koraa na afei wo start a ɛyɛ very advisable sɛ obey no step by step. It means very short distances. And we a short distance and not gradually, you can then increase that distance. And no, a basana, then you are kind of training the heart to work. Now, what happens when they say a basa when you be a jog, not be a starting, not be a vigorous, you want to jog longer distance. Now, of course, there is you overworking the heart. The heart is a muscle, muscle. Don't pay any. And the muscle won't working out, definitely it takes a bit of time for you to get, for the heart to actually get used to it. And that could be a contributor to that burning sensation, because normally if the heart that is not active and it doesn't pump efficiently to circulate your blood with oxygen to feed the heart muscles, but baby amujan kubiado a yaw ebaho, and answer there's a sensation there, not only in the heart but also any part of the body. That is, it could be the primary cause of this issue.
All right, thank you very much, Isaac. Doctor Abua Kakra.
Yeah, madam say.
Okay, all right then.
What's my more question?
You, I just say any doctor, it's you.
Doctor, and also the Yakupon acid amount, and that was bring a brain now. Now, dog, young business said, we say, Nipa, Yabra body, only when money or bank it and we so can you brabo, a guapa. Now, a day effect, and when money or bank it and we a Yakuma so. Especially, if you be an inferior, above 40 upwards. Effect, then a war Yakuma so. Nay, Kakuma was a media, which is Kakama.
Yeah, so Onim says Obama from 40. In fact, from 40, most men or women, they have arteries very healthy. Arteries start to say a year hardened, and I say elusu ne flexibility from 40 in the aircon. And most people, depend on their lifestyle and maybe any demon a bit to me, and so I say, enye free. And that is one of the issues. In the general circulation quite poor. And because of the general circulation, poor commands be a so form. Now, depending on that, sebe Obama moja amfa nipadua ya moja no ene the primary base ma Obama bema. In fact, that is it is known, scientifically proven. And this is some of the reasons, and I said the main reason, say Obama, if he can be sexually affected, that could be the reason. I bet me at the problem at the Abba in connection with the heart. So Obama with a higher age, nase ninchimunye free. In fact, in the health of the heart and kasano. Now that the person is maybe taking Viagra and so on, overworking the heart now. That could even lead to this, sudden cardiac death. It happens all the time now because the person cannot perform, but is still taking this Viagra and so on to overperform. Now, and also overwork the heart. That can definitely lead to further weakening of the heart. So I don't know if I've been able to answer the question well to you.
Petron, are you okay?
That's
Okay, thank you very much. Yo, doc, ansa na abekọ de mu se brana so de na mu ansa na abekọ no.
Papa smile. O man paka.
Ansa because mrena so. Fa onua ba akọ question na ode aba. Enso so na ma doctor enko. Why? Da for e beto aso. O say working kan bibi wo ba bi a e kire se wo se nka nipa de utimi da o left side no more than so be da o right side. It has an effect on the heart. Or pursue who if there is any truth in that. And I'll say dark chocolate and you be a year for a year na say sure say for a commano and wasem. And the other one no yeah a day and a day migraine eba. These questions kakra bit me account the answer so.
Yeah. May start with the left about the sleeping position. In fact, the best sleeping position is sleeping on your right, because the left side on the air where the heart is. When you sleep on the left now, I don't know where he got the information, but it's completely untrue, because when you sleep on your left now, definitely no, you put too much pressure on your heart, which is not very helpful. You have to sleep on your right or sleep on your back. So these are the best sleeping position. You sleep on your left, you put too much pressure on your heart. It's not okay for the heart. The other thing is about dark chocolate. When you get quality dark chocolate, dark chocolate is very, very healthy for the heart, but not to eat it too much. If anything that is healthy, when you take it too much, it becomes a problem. And when you eat quality dark chocolate now, it supports your heart, is very, very healthy until you can take it. The other thing is about the migraine. There are a few factors that migraine but normally it's about the nerve supply. If the nerve supply is somehow is distorted now, it can cause that problem. Also, blood supply is another cause of migraine. These are the two key issues. It could be infection in the inner ear. Sometimes it could be coming from the liver. Liver health, if it's not working really well now, it can cause headaches, general headaches. Most of it from the health of the liver or your gastric health. If you have constipatory problem. These are some of the factors. But migraine is about the blood supply and the nerve supply, actually.
Thank you very much, Doctor.
Yeah, you're welcome, Papa.
Yo. Any for kwan etudwe ansa na wadwane kora. Why?
Any brothers, I can see any woman here. So all brothers, I can say I appreciate you all, and those every 2 weeks to come together to share this health issues, to encourage ourselves. Say bia when it hono person me kasa na so humia or London ha ye wo Woolwich Arsenal I Bain Canning Town and then Stratford and yet Irakwankra. You can call me from Monday to Saturday, but it's on only appointment basis. Number obetime reach me on offer outside the UK +44 738 464 7300 offer within the UK, so 07 38 464 7300. Appointment basis enquire and walking to bet me aframe. Obaha your fidia besho ni peduenum na yahwɛ deɛ ɛkɔ so sisi anaasɛ deɛ nam kwan so ba biribi ani hɔ a sɛbi ɛsate fi mmɔgyam anaasɛbi wotie fi mu anaasɛ odwo nso biribi bɛbɛ those media na sɛ ɛyɛ too late nti meda mo ase paa sɛ moayɛ aso a matie me nnɛ ayɛ nso for also those lovely questions. Papa nso nyame ɛnhyira. God should continue to bless you and also empower you with our wisdom. And then next 2 weeks, and also
na doctor, we okokra no. Nti yenya chewing we ana.
Papa, chewing gum contain aspartame. And when you read about this aspartame now, in fact, it's been known for ages, and it contributes to cancer formation definitely, because it's known officially. It causes it's an agent of cancer. And so we shouldn't be chewing the chewing gum, definitely. And no, we shouldn't also be drinking that Diet Coke and this and the energy drinks, a quite serious issue. Yeah.
Well, for lack of knowledge, my people perish. Now we know.
That's right.
It is next for us to practice it so that we won't perish. Truly perish. Thank you.
Exactly. So the knowledge only comes through through action. They're practicing it. Now without practicing, you can't have any power or that. Yeah.
Good one there, Doctor. Thank you once again. Bye bye.
You're welcome, Papa. Goodbye now. Bye bye.